Have you ever seen someone who frequently forgets things? Do you think that memory loss with age is normal? Do you want to know when this problem turns into Alzheimer's disease? If yes, then this video is for you. Today we are going to talk about a very important topic, Alzheimer's disease. This is a condition that affects many people, especially older adults. Let's understand. Firstly, we will look into what is this? How many types are there? What are the symptoms? What causes it? What are the treatment options? And finally, the conclusion. First, we will understand what is Alzheimer's disease. Let's see. Alzheimer's disease is a brain disorder that gradually destroys memory and thinking skills. Over time, it makes it difficult to perform even simple tasks. It's the most common cause of dementia, which is a general term for memory loss and other mental abilities that interfere with daily life. I hope you now have a bit of an idea about Alzheimer's disease. Let's move on to the next point where we will learn about its types. Let's look at its types and understand them one by one. There are mainly two types of Alzheimer's disease. First, early-onset Alzheimer's. This type occurs in people who are younger than 65 years old. It is less common but can happen to people in their 40s or 50s. For example, a person might start forgetting important appointments or how to do their job. Second, late-onset Alzheimer's. This is the most common type and occurs in people who are 65 years old or older. An example is an elderly person who starts forgetting the names of their family members or how to get to familiar places. Friends, these were main two types of Alzheimer's disease. Now, let's move to the next point, where we will learn about its symptoms. Alzheimer's disease has many symptoms, but in this video we have covered some common ones. Here are a few common symptoms of Alzheimer's disease. Alzheimer's disease has a range of symptoms that worsen over time. Here are 5 common symptoms with explanations, such as memory loss. One of the earliest and most common signs. Individuals may forget recently learned information, important dates or events, and may repeatedly ask for the same information. Next, challenges in planning or solving problems. Difficulty in developing and following plans or working with numbers. People may have trouble following a familiar recipe or keeping track of monthly bills. Next, difficulty completing familiar tasks. People may find it hard to complete daily tasks. They might have trouble driving to a familiar location, managing a budget at work, or remembering the rules of a favorite game. Next, confusion with time or place. Losing track of dates, seasons, and the passage of time. They may forget where they are or how they got there. Next, changes in mood and personality. The mood and personality of people with Alzheimer's can change. They can become confused, suspicious, depressed, fearful, or anxious. They may be easily upset at home, with friends, or when out of their comfort zone. So friends, those were some common symptoms of Alzheimer's disease. If you have information about any other symptoms, please write them in the comment box. Now, let's move on to the next point. What are the causes of Alzheimer's disease? Let's see. The exact cause of Alzheimer's disease is not fully understood, but it is believed to be due to a combination of genetic, environmental, and lifestyle factors. Here are the main factors that may contribute to the development of Alzheimer's, such as genetics, family history. Having a parent or sibling with Alzheimer's increases the risk. Specific genetic mutations, such as those in the APOE gene, are known to increase the likelihood of developing the disease. Next, age. Age factor. The risk of developing Alzheimer's increases significantly with age. It is most commonly diagnosed in people aged 65 and older. Next, brain changes, amyloid plaques and tau tangles. Alzheimer's is characterized by abnormal buildups of proteins in the brain. Amyloid plaques and tau tangles are thought to disrupt cell function and lead to brain cell death. Next, environmental and lifestyle factors. Lifestyle and health. Factors such as a sedentary lifestyle, poor diet, lack of social engagement, and conditions like diabetes and cardiovascular disease can increase the risk of Alzheimer's. Next, head injuries, traumatic brain injury, TBI. Severe or repeated head trauma has been linked to an increased risk of Alzheimer's disease. These were some common causes. Now let's move on to the important points. where we will learn how it is treated. Alzheimer's disease can be treated in several ways. Let's see. While there is no cure for Alzheimer's disease, treatments can help manage the symptoms and improve quality of life. Here are some common treatment options, such as cognitive therapy, cognitive behavioral therapy, CBT. This therapy helps individuals manage anxiety, depression, or other mood disorders that may accompany Alzheimer's. It involves working with a therapist to develop coping strategies and mental exercises. Next, lifestyle and home remedies. Healthy diet. A diet rich in fruits, vegetables, whole grains, and lean proteins can support brain health. The Mediterranean diet is often recommended. And physical exercise. Regular physical activity can help improve mood, maintain general health, and slow cognitive decline. Next, supportive care. Creating a safe environment, modifying the home environment to ensure safety, such as removing tripping hazards, installing grab bars in bathrooms, and using locks on cabinets. Next, support for caregivers. Education and training. Providing caregivers with training on how to care for someone with Alzheimer's, including managing behaviors and understanding the progression of the disease. Friends, these were the methods to treat Alzheimer's disease. If you feel any point was missing in this video, please do let us know in the comments section. Finally, let's look at the conclusion. Alzheimer's disease is a serious and progressive brain disorder that impacts memory, thinking skills, and daily functioning. Understanding the different types, recognizing the symptoms early, and being aware of the potential causes can help in managing the condition more effectively. While there is no cure, various treatments and lifestyle changes can improve the quality of life for those affected. Early intervention, supportive care, and education for caregivers are crucial in dealing with this challenging disease. Thank you for joining us today to learn about Alzheimer's disease. It's important to stay informed and support those who are affected by this condition. If you found this video helpful, please like, share, and subscribe to our channel for more informative content. Stay healthy and take care of each other. See you next time.